I want to spend some time today talking about lab tests. And what tests do you really need in order to maintain a health span that's going to last for a long time? One of my pet peeves is people come in with 20, 50 pages of lab work. And really nobody has ever spent the time to go through a lot of that lab work with them. They come in with all these labs that were ordered by one or another provider and not really anybody who's made sense of them. So do we need all these billions of labs? I really want to make the argument that we need some basic, simple things when we're trying to look at optimizing health span. When our clients sign up for a longevity program, we start out with some of the things that are the most important to just look at baseline health. And those are pretty simple. One is just a complete blood count. And from a complete blood count, what's called a CBC, you can glean so much information. Even functional medicine doctors don't look at this with enough detail. So what little secret pieces of information are in a complete blood count? Number one, you need to look at the white blood cell count. That should be kind of in the mid-range. But what's more important is what makes up those white blood cells. Our white blood cell population has a lot of different types of white blood cells. That includes neutrophils, lymphocytes, monocytes, eosinophils, and basophils. Now, what we really want is about 90% of our cells to be in that neutrophil and lymphocyte category. Those are your soldiers. Those are the guys who are going to help you fight off viral infections and bacterial infections. Then the other 10% can be made up of what we consider more the inflammatory phase white blood cells. Those are the monocytes, eosinophils, and basophils. Those cells are reactive. Now, there's always stuff going on. You're always going to see those cells. But we want less than 10% of our cells to be in that reactive phase. So let's say you're somebody who has tons of allergies. Then potentially your eosinophils are going to be much higher than they should be. And that's going to be taking some of the population away from those really infection-fighting cells, or your neutrophils and lymphocytes. If you're really inflamed, then your monocyte count is going to be high. Remember, those are macrophages. Those are the guys who are eating cholesterol and creating plaque. We want to make sure that the monocyte count is not too high. Ideally, when we add together those monocytes, basophils, and eosinophils, less than 10% of our cells should be in that reactive phase. So it's a huge amount of immune information to be found simply in that white blood cell count ratio. The next thing you're going to look at is the mean cell volume, or what's called the MCV. And that mean cell volume has so much critical information in it. If that number is really elevated, for longevity, we want that mean cell volume less than 92. So if that's very elevated, it can mean a couple of things. Number one, it can mean that you're having problems with methylation, and you have low levels of methylated B12 or low levels of methylated folate. That mean cell volume will start climbing. It means our cells are more in a state of disarray when we see that. That's the size of your cells. We don't want these big, ugly cells. We want nice, small, healthy cells. So when we see these cells in that state, first thing we're going to look at is make sure there's enough methylated B12, methylated folate. But sometimes you'll see it just creeping up. Not super high, but just creeping up as we age. And the reason is because we have dysfunctional autophagy. We're not getting rid of those bad cells well. They're nice and healthy, and then they start aging. As these cells age, they get larger. They get filled up with these senescent proteins. And they actually start spewing those senescent proteins around, which can start damaging other cells. We call these zombie cells. And zombie cells are going to be larger, and they're going to be more damaging to the cells around them. So when you see an MCV, or mean cell volume, starting to climb, the other thing you want to look at is, do we need to work on clearing out these senescent zombie cells? And we can do that with things like spermidine. So you can do a high dose of spermidine for about 6 weeks. There's some peptides that can help to do that. And there's other things like quercetin, dasatinib, fisetin that also are senolytic agents. This might be a place where I actually use rapamycin. I don't use a lot of rapamycin, but it might be a place where rapamycin becomes useful, because what rapamycin is doing is sort of cleaning house. So look at that mean cell volume. Look at that white blood cell count. Look at the differential there. Lots of information about your immune system and about your health simply from those numbers. Now let's go to the next simple test. These two tests in and of themselves give me so much information, and they're $12, a comprehensive metabolic panel, or CMP. So what's in a CMP? Your doctors always run it. They just don't look at it with the same detail that you should be. So in that CMP, it's going to tell you about your liver functions, your kidney functions, bone health. There's a lot of information there. So the first thing you're always going to look at, sort of at the top, is just the electrolytes, the sodium, the potassium. Are those all normal? And typically, unless you're sort of sick or really dehydrated, those are going to fall within normal range. But even people who are walking around lots of times with a relatively low sodium, like 133, 134, so it's just on that lower end, one of the things that can signify is that there's more problems with the adrenal function with aldosterone levels. And we know that these very low aldosterone levels can affect things like age-related hearing loss. So it's important that that sodium is kind of in mid-range. It's why you have to be careful that people are on all these sodium-restricted diets. A lot of people don't need a sodium-restricted diet. In fact, I would venture to say most people don't need a sodium-restricted diet. The other thing that people don't look at is that CO2 level. So you'll look at the CO2. What is that telling me? So that's telling me whether my body is acidic or alkaline. That's important because our bodies function better when they are in a more alkaline state. If that CO2 level is less than 24, it means you're running a little more acidic. Above 24 means we're a little more alkaline. Our immune systems function better when we're alkaline. Our muscles are healthier and can form more when we're alkaline. But our life is acidic. Stress is acidic. High protein diets are acidic. Poor sleep makes us more acidic. A lot of typical diets that we follow are more acidic. So we really have to work to make sure that we're alkalinizing people. And that can be done simply by taking things like Alka-Seltzer. You want to make sure you do the Alka-Seltzer without aspirin in it. Alka-Seltzer is basically a sodium bicarb, or you can buy online a sodium potassium bicarb and take that to help alkalinize yourself, especially if you're eating a high protein meal, which can have a lot of acidity to it. Or those of you who like your carnivore diet, typically people on a carnivore diet are a lot more acidic. You can also use a little bit of baking soda and water. But alkalinizing is really helpful to the body overall. So look at that CO2 value. Less than 24, work on making yourself a little less acidic. Eating healthy vegetables along with your meats, things like that. Those are also techniques that will help that. Now you're going to move down and look at the biliary system. You're going to look at your AST, your ALT, your bilirubin. That's important. If your liver enzymes are going up, they're elevating, they're getting above 40, likely the liver's in a stress state. Lots of things we do can create stress in the liver. The biggest culprit is alcohol. And even a little bit of alcohol, depending on you and your genetics, can cause elevations in liver function. High protein diets can sometimes stress the liver a little bit as well. Usually that's not a big case, but sometimes like if you ate a big steak and the next day you got your lab done, you might temporarily see a little elevation in liver enzymes. Usually those come right back down. The other thing is that you can look at total bilirubin. You see this more commonly in men, but something called Gilbert's. It's a benign disease with a little bit of elevation in bilirubin. It's interesting that those people who have a tiny elevation of bilirubin probably to their advantage. But if that number is really high, then we should look at the gallbladder function. Is the gallbladder not doing its job appropriately? Gallbladder is very important for digestion of our fats. So look at that bilirubin. A little bit elevated, not a bad thing. Very high, start looking at biliary function and see what's going on. The next thing you're going to look at is kidney function. Now, kidney function is interesting on a comprehensive metabolic profile. What we do is we look at what's called a BUN, a blood urea nitrogen, a creatinine, and then the computer calculates what's called a GFR, or glomerular filtration rate. It's a calculated number just based off of creatinine. But creatinine can be deceptive. If you're eating a high protein diet, or have a lot of muscle mass, or if you're taking creatine, then it will artificially be elevated. And then your doctor will look and say, oh my gosh, your kidneys aren't working well. Not true. That may just be a lab dysfunction because of the way the lab measures creatinine. So what the other test I think everybody needs, if you really want to evaluate kidney function, is what's called a cystatin C level. Most doctors won't check this, but it's important, especially for those of you guys who exercise a lot and for those of you who are taking creatine. So make sure that you check a cystatin C. If the cystatin C is elevated, then the kidneys are truly stressed. Start with looking at that BUN creatinine with a little skepticism. If you're somebody who's high muscle mass, like my bodybuilders who have huge muscles, they oftentimes will have high creatinines. That's just because they have a lot of muscle, and muscle breakdown will create higher levels of creatinine. So look a little skeptically at that GFR, but you can still use it as a guide I advise everybody gets a cystatin C level as well. Next thing you want to look at that gets sort of underplayed is the alk phos. Alkaline phosphatase comes from liver, lung, bone. So it's a nice little loose marker that something's going wrong. I like to follow it for looking at bone health, because if that number is elevating and there's nothing going on with the liver looks good, and I'm not really suspicious of lung problems in that person, they're not a smoker, things like that, then likely that little elevation in alkaline phosphatase going from 50 to 60 to 80 is because we're starting to lose bone. It's a nice little gentle marker that you can see to evaluate what's going on with somebody's bone density. That's an underutilized marker. If I start to see that climb, I'm going to make sure my patient gets a DEXA scan, make sure I'm looking at their bone health, both men and women. That number really ideally should be less than 65. CMP has tons of valuable information, underutilized information that can be really helpful to you. So those two starting tests are going to be huge. That's a $12 test that you guys can look at and get all this information from. Start there. If you're paralyzed by this longevity world, start there. It's simple. There's so much data there. We have an online course, if you go to bli.academy, that teaches you how to read those labs so you can understand them yourself. Understand that you can even order your own labs. People don't know that, but you can order your own labs. If you're not going to use insurance, you can just order your own labs and go to LabCorp Request and get these labs done. Look at our course. Now, obviously, it's helpful to have a functional medicine doctor to go through them with you, but if you can't afford that, there's simple ways to address longevity with some simple tests. If you liked this, please give it a thumbs up. Please share it. Please comment. Let me know what you did like, what you didn't like, what you want to hear more of. Join our channel. Come to our Instagram at Dr. Yurth at Boulder Longevity Institute. And we hope to see more of you.